More than 100,000 doses of the monkeypox vaccine have been acquired in order to combat the spread of the virus, the government has said. Last month, the NHS stepped up its monkeypox vaccination programme in England as infections rose. Vaccines Minister Maggie Throp said the majority of vaccines were being made available in London, with about 75% of confirmed cases in the capital. But she urged people to wait to be invited to receive their jabs. While anyone can get monkeypox, the majority of those with the virus are of a certain nature and other men who have sex with men. The latest figures show that nationally there have been 2,436 confirmed cases, with 1,778 of those in London. Across the capital, there are more than 18 clinics offering vaccinations, including the Dean Street Sexual Health Clinic in Soho, Chelsea and Westminster Hospital, Guy's Hospital in Southwark, Mortimer Market Centre in Camden, and Barking Hospital Outpatient Centre East. During a visit to a clinic in Hammersmith, Miss Throp told BBC London, "We've procured over 100,000 doses, and that is the most of any other EU country, so we're definitely ahead of the game on that." Last week, the European Commission's Health Emergency Preparedness and Response Authority, HERA, said 109,090 doses had been procured since the outbreak began. Spain received 5,300 doses, while Portugal, Germany and Belgium were next in line to receive vaccinations. Miss Throp added, "We are still at a bit of an unknown with this, and we have reached out to the sexual health clinics, asking them what numbers they have in their clinics of those needing to get jabbed. We've got to get the first doses in people's arms. That is our priority. We need to make sure we have the right cohorts of people coming forward." More than 16,000 cases of monkeypox has been reported in 75 countries, according to WHO Directors General Dr. Tedros Adhanom Ghebreyesus. He said there have been 5 deaths as a result of the outbreak. One issue regarding the vaccinations is how best to organise the programme. Perhaps in the absence of clear public messaging, but through an effective grapevine. People have been queuing around the block for a weekend drop-in centre at Guy's Hospital. It may have given the impression of panic or a system creaking under pressure, but at Chelsea and Westminster Hospital's 4 clinics, they've been successfully harnessing the logistical lessons learned from COVID. They've been poring over their patient database, inviting by text those deemed most at risk, and processing dozens of people by appointment every day. There are some who think monkeypox needs a SAR to be appointed to oversee the handling of the response to the outbreak. Maggie Throp says for the moment she's content with the way vaccines are being distributed and that people with symptoms are being well advised. But it's a 2-dose treatment, and for the moment, although more doses are being manufactured, the minister isn't saying when they will be made available.